now we're going to the next speaker, Dr. Contreras Rosa from Honduras. And the thing is that we will be forced to show the video recorded presentation by him because he cannot, activate the microphone now due to technical reasons. But he has pre-recorded his presentation, so we will just watch it together with you. We had to, change the schedule, as I have told you earlier today in the beginning. So, and it will be a half-an-hour presentation by Dr. Contreras, and then it will be a half-an-hour presentation by me. And then we will continue with Tiffany Bersotti, and I have seen that Tiffany has already joined us. So let's go and watch the video.
Hello, I am very glad to be with you at this important BioWell Congress. My conference is related to biological methods and manifestation of human energy in restoring health. In recent decades, two apparent opposite systems have emerged in medicine that can be implemented for the purpose of health maintenance and recovery when the delicate balance of homeostasis is lost. These systems are basically orthodox, facultative, allopathic medicine and alternative and complementary biological medicine. The medical care of nearly 30,000 patients during 45 years of continuous professional medical practice is analyzed and intertwined by the author at his Biological Medical Center in Siguatepeque, Honduras. The foundation of this experience is based on the constitutive systems of the human being, from the subtle to the concrete strata described as follows: the atmic of the soul and of the spirit, the mental or the human mind, the akashic or the akashic record, the astral or the astral body, the aural or human aura, that of the chakras or luminous electromagnetic center, the energy system of traditional Chinese acupuncture, the quantum with its subatomic particles of the physical body, the cellular system forming tissues, organs, and viscera, the muscles, skeletal, and other body support tissues, and the central nervous system, brain, and spinal cord with their peripheral nerves, and the autonomic nervous system, and of course, also the circulatory. The skin, with its energy system of the aura minoris and its own bioelectrical activities and its annexes, such as nail, hair, and sebaceous and sweat glands. Together, the situation of the natural environment in which the patient lives, the family and social environments, and the abnormal situation of other organs that affect health are considered. In the medical records, the general data of the patient, the reason for their consultation, and the history of previous illness, traumatisms, and surgeries, gynecological and obstetric antecedents, underlying diseases, and the medication they use are broken down. Also, antecedents of parents, sons and daughters, and close relatives, and the stressful situation they have had or currently have, such as smoking, alcoholism, and other drugs, including medications. Then, predominant miasmas and characteristic of homeopathic constitutional remedies and signs that are found on physical examination from head to toe are noted, giving importance to the search for deformities in the skull, such as depression and bulges, scars, and others. Thus, maybe fields interference in the style of Huneke Neural Therapy and under the concept of craniosacral therapy. Changes are shown in the ocular irises, in the tongue, in the teeth and palates, and in Valdeyer's tonsillar circuit and the sinus area. Dr. Walter Huneke and Ferdinand Huneke, fathers of the neural therapy in Germany. Neck palpation is very important to discover alterations in the cervical vertebra, such as Adler's sign of neurofocal dentistry, and their correlation with teeth and molars, especially wisdom teeth, passing to the anterior neck to detect lymph nodes and changes in the thyroid gland. In addition to the supraclavicular spaces in the trunk of the body, auscultation of the heart and lungs, as well as the abdomen, without forgetting the pressure of the navel to detect if it is painful and if the pain irradiates to other abdominal areas, and the surgical scar are explored and drawn in the file for being a frequent cause of energy leakage to outer space. If the female patient requires a gynecological examination, it must be performed. Such frequently reveals various alterations. And in the case of men, we perform the prostate examination in order to detect interfering fields to the energy circuits according to Chinese acupuncture and Huneke Neural Therapy. A very important exploration is that of the spine to see positional changes, scoliosis and kyphosis, cervical and thoracolumbar spans, and alteration of the sacral coccygeal area. And then the upper and lower extremities, their osteotendinous reflexes and traumas such as ankle sprains that it is usual that they are not healed, and the scars are still small like those of Jenner and BCG vaccines. We also see the changes in the nails and fingers, in the palm and soles in consideration of reflexology. We move on the vital sign of blood pressure, body temperature, height, weight, heart, and respiration rate. We appreciate the appearance and vitality, timbre of the voice, gestures of body mechanics. We try to appreciate miasmatic and constitutional tendencies according to the classical homeopathy, and inspection of the changes in the tone. We palpate the Chinese pulse to make an input diagnosis. We come to the review of laboratory radiological tomography and magnetic resonance studies, among others, and those indicated by us, such as the pH of saliva, to detect the acidity and alkalinity of body fluids. We measure oxygenation with digital oximetry and monitoring of cardiac waves to confirm the good cardiac and pulmonary function in the patient. Prior to other studies, We focus on clinical diagnosis if possible, and it is quite frequent that we carry out an analysis of the interpretative pathophysiological chain, globalizing the data of the clinical history. We explain to the patient and his companion his case, and we give him recommendations and others to study that are needed to specify diagnosis, such as the Coagulated Blood Drop Test, or HLB, an acronym for Dr. Heitan Lenard Bolen of the USA. You can see some pictures about the normal test, small, vitamin C deficiency, intercalcemia, and so more. Bolen was a medical researcher who developed it in the 1940s and 1950s to investigate the morphological changes seen under microscope related to toxic oxygen species present in many diseases, giving rise to antioxidant therapy. We have digital iridology to see the observable morphological changes in the irises of the eyes in acute, subacute, and chronic forms in the tissues, and neurovegetative, visceral, osteoarticular, circulatory, and skin systems. Digital iridology details in an extended way the sign of various diseases, such as they are studied in the books and other publications of iridology, constituting the examination an excellent aid in clinical diagnosis. With full electroacupuncture, EAB type electronic devices, we can measure the general body energy, the balance of the upper and lower quadrants, and of the right and left side of the body, and we can measure the acupuncture points in the hands and feet, and any another, like Dr. Reinhold Paul did in Germany. And we do all worldwide as disciples of this great genius of alternative and complementary medicine, without forgetting the Japanese Ryodoraku system. Something important is to measure the dental patho-galvanism in metallic mercurial amalgams, cause of poisoning and diseases at a distance, that is, outside the mouth. During my biological medical practice, patients have been duly documented, analyzed, and treated with the application of unique or combined medical, alternative, and natural techniques. The following are cases treated with me with these medical approaches. My first patient, upon returning to Honduras in 1975 with a specialty in traditional Chinese acupuncture from the Medical University of China in Taiwan, was a 52-year-old adult with a history of oral lesions due to aphthous, commonly called fires, with several years of evolution. I treat him only with acupuncture at point large intestine 4 and stomach 4, located on the hands and on the sides of the corner of the lips, since these points treat excess heat or fire in the body. He returned a month later, happy, very happy, because the lesion disappeared and did not present them again. A 2-year-old male patient with rectal prolapse every time he defecated, and that was cured with a single moxibustion treatment in the cranial vertex, 0.220 by weight. to energize the Du channel or governor vessel that goes from the anus and rectal area to the head. A 5-year-old patient with sleepwalking that disappeared after Huneke Neural Therapy treated the epigastric scar after having been operated on the pyloric stenosis a few days after birth. A 7-year-old patient suffering from infantile cerebral palsy after being vaccinated against measles, which damaged her brain, and receiving the homeopathic remedy morbillinum caused said moxa to break out on her skin, improving her disability condition. A 13-year-old patient with blindness due to panophthalmia in her right side, recovering in a few days after removing a dental rest between the upper right canine and the fourth premolar, accompanied by Huneke Neural Therapy in the sphenopalatine ganglion on the same side and periocular points. A 14-year-old male patient with asthma since he was 2 years old that gradually improved with alternative treatment and was completely cured with enhanced stem cell therapy. Now, a very successful 40-year-old professional in the diplomatic service. A 16-year-old patient with symptoms and signs of Guillain Barre recovered with acupuncture treatments, neural therapy, and the homeopathic remedy Helsemium. A 16-year-old female patient, a basketball player with pain in the flank and lower right limb for 6 months due to misalignment of dorsal vertebra 6, treated with chiropractic adjustment that led to the disappearance of that permanent pain. A 18-year-old patient with grand mal type epilepsy, whose study reveals the presence of 4 wisdom teeth include that disappear when removed under surgery. An adult male patient with insomnia of 27 years of evolution, treated with auricular electroacupuncture that led to healing. An adult male patient, persistent smoker that for more than 30 years, treated with ear medicine that cured his addiction without smoking again. A Belgian male patient with a very good physical constitution, suffering from the left sciatic pain without apparent cause, treated with exodoncia in the lower left premolar fold that showed necrotic root, eliminating his sciatic. Adult patient woman, a secondary school teacher, disabled due to very intensive right sciatic and without apparent cause, treated in 2 surgical scars of the right abdomen through therapeutic neural interference with procaine that eliminated the pain, who got up and walking in a few minutes, clear phenomenon in seconds, according to the medicine of the Huneke brothers, known as German Acupuncture. A 68-year-old male patient with left facial paralysis that appeared suddenly, whose studies only revealed the presence of a left lower wisdom tooth. The removal of it caused the flaccid facial muscle structure to suddenly engage and heal in a few hours. A 56-year-old female patient with a depressive picture due to the death of her husband, recovering in 4 days but listening to classic music 2 or 3 hours a day. A 69-year-old female patient with various health problems, the BioWell study showed a misalignment of 6 chakras, treated for 2 weeks with light therapy and quickly achieved notable improvement. A 44-year-old female patient with rheumatoid arthritis causing intensive pains throughout her body. The conventional treatment of cortisone, Imuran, methotrexate, and chloroquine was withdrawn as a probable cause of intoxication, and she was placed on a strict fruit diet, watermelon, pineapple, and papaya, as the only food for 1 month, achieved the disappearance of pain in just 1 week, and the polyarticular inflammation in 2 months. A 76-year-old male patient with a marked lack of energy confirmed on his BioWell exam, treated with 6 solutions from a constellation of metals, including calcium, magnesium, manganesium, phosphorus 1 and 2, molybdenum, potassium iodide, copper, chromium, selenium, and zinc, managed to increase body energy quickly until she felt good in 2 weeks by activating the cellular enzymatic system that generates energy producing biochemical reactions. A 60-year-old female patient diagnosed with a cancerous tumor in the right hepatic region, rounded 10 by 10 centimeters, who refused to undergo surgery and required treatment with biological medicine. A biweekly injectable combined treatment of ozone with amygdalin or vitamin B17 or Lytril was recommended. With abstention from meat and dairy in his diet for 6 months, the tumor disappearing and the good health for come back for another 15 years. Older male patient with different ailments and belief of being bewitched by an evil that had been done to him. Coming with his relative, he was asked to see his aura with the explanation that there were whole strained areas of blackish patches. It was a curse, but if it had normal colors, it was not. The aura majoris appeared very nice, well-defined, white color, and seen on the screen of the ABS system. Convinced that he did not have that problem, the patient agreed to enter treatment. Conclusion: the Biological Medical Center has gradually incorporated instrumentation that allows visualization and measurement of human energy manifestations. Practicing mapping with thermographic camera allows impressive finding of various alterations in the head and spine, neck and thorax, abdomen and extremities, including traumatism with sinking and bulging of cranial bones, spine column, pathology of the liver and colon, varicosities of lower limb, between others. You can see these kind of changes in their body, especially this very strong trauma in the upper back of the head. The thermovision technique was visualizing the aura majoris, managing to analyze the radiant luminous color and better understanding of the patient personalities, with recommendation that improve their health and usually the light therapy treat alteration. You can see this color, the other color, and the green and blue colors of different patients' auras. With the biowell, the etheric energy of the aura minoris attached to the skin was captured by DVD, allowing the bioelectrical discharge to be seen, a breakthrough in holistic medicine innovation. The biowell also allows you to show the patient their health condition, their homeostasis, and their imbalances in their health. You can see, all these frequent figures taken by biowell system. The long road of our medical services leads to formation of a biological medical institute in a few weeks, in a few months, with alternative and complementary biological medicine, ancient and modern, strengthened by technological advances on the threshold of quantum medicine. Institute of Medical Biological, Dr. Roberto Contreras Rosa. Thank you very much. I appreciate all of you, especially Dr. Korokov and Dr. Orlov and all their participants in this important Congress, BioWell Congress. Thank you very much. Bye-bye.
Okay, so this was the presentation by Dr. Contreras. Well, I can say I've been writing down lots of those interesting tips from those cases that he has presented. Very, very interesting ones. And some of them I would say will be helpful even for my personal lifestyle, about those metals, about those other components and maybe teeth, etc. So very, very much appreciated, Dr. Contreras, for sharing these results with us. Well, I hope that next year you will have more interesting results to share, and it will be much helpful if you will show not only the text, but also some images so we can see the actual measurements. It will be also very, very helpful. Dr. Contreras, hello. Hello. I remember there was one of the cases that you have shown us yesterday from many of them. There was one case when number 18 or 19, I don't remember exactly, when there was some pain problems for the person or some issues with health. I don't remember exactly what are the names. And then the solution was that you have prescribed this person 6 different metals to take them. So, and he was taking those zinc, magnesium, etc., etc. I don't remember all the names of those metals. There were 6 of them. I can look at them later on, but can you explain us how you came to such a conclusion, like that this exact person should take these specific metals as, a solution?
Yes, of course. Yes, of course. Hello.
Yeah,
hello.
We can hear you.
Okay. Good morning to everyone. This conference, Dr. Constantine, was extraordinary. It's a complete approach to my clinical lecture by the way of studies and instrumentations. Excellent. Well, in the case of a patient with lack of energy that was confirmed in a biowell test, the human body has the intermediary system of enzymatic reactions. There are 35,000 reactions by minute in every cell of the body. This is like thousands, like a cosmic numbers, astronomical numbers of reactions in the cells by each minute. Then the enzymes use metals for their nucleus to activate the production of energy. And then when we use the constellation of metals, it's a strong activity of the most of the enzymatic system that induce the reactions, thousands of reactions to produce energy. That's why the patient start to improve the energy just in a few days, 3, 4, 5 days, 1 week, 2 weeks, extraordinary recoveries in case of lack of energy of the patient.
So did this patient just took pills like with those metals?
Sorry, I understand.
Did this person took pills?
Tablets? Well, in a clinical way, the patient start to feel his or her energy getting better and start to make everything fine in his life within a few days. This lack of energy in her case was a default, decrease, deficiency of this kind of enzymatic reactions due to the lack of metals. This is very important therapy. Was used in Venezuela long ago to treat the cancer's problems. Was a very famous doctor there that cured a lot of people with cancer. Many cancers, the problem is the lack of energy in the cells.
Interesting.